बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is female, almost 45-year age patient with history of palpitation, heat intolerance, weakness, and mild tremors for the last 12 years. So I am going to scan the neck region for thyroid gland. Here we can appreciate this is the right lobe of the thyroid gland, which is bigger in size, enlarged, heterogeneous, and hypoequic. And look at the borders. These borders are smooth. I cannot appreciate any irregularity in the border of the right lobe. And if we closely observe, we can appreciate this hyper-equipped nodule, which is well defined, well marginated, no cystic change is seen at present. This is another nodule having a smooth border, and this is another nodule. So we can appreciate that multiple nodules are present in the right lobe of the thyroid gland. And this is the trachea, and this is the isthmus of the thyroid gland, which is also hypoequic, heterogeneous, and it is also bigger in size. This size is too much when compared with the normal. And now I'm going to the left lobe of the thyroid gland. Here we can also appreciate larger left lobe, hypoequic, and heterogeneous. However, we can appreciate that the hypogenicity of the ecotexture is smooth, not nodular, and the surface borders are regular, well defined. And this lobe, left lobe, is also containing multiple nodules. This one, this one, this one. These are hyperequic. And look at the border of the nodule. This is well defined. No irregularity is seen. It is not infiltrating or penetrating the gland, and also there is no calcification we can appreciate within the nodules or at the periphery. So such type of sonographic feature are usually benign. If the calcification irregularity is present and it is infiltrating the gland, not having clear cut margin, uh, then then we can say that it is the malignant nodule. So this is sonographically it is seems to be the benign. So when we have seen that uh, features are the gland, thyroid gland is enlarged, hypoequic, heterogeneous in ecotexture, not nodular, smooth ecotexture, and also the border margins are regular, containing the multiple well-defined, well-marginated hyperepic nodules in both lobes. Larger one is on the left side, having the benign sonographic feature. So this is the description which we have seen sonographically. Now here we are now going to put the color. What is the vascularity? Look at the vascularity of the right and vascularity of the left. So as I have told you that history is for the last 12 years, and still the gland is bigger in size. And when we talk about such a sonographic picture having uh, enlarged, hypoechoic, heterogeneous thyroid gland showing the thyroid inferno type vascularity, two diseases are in our mind, Hashimoto and the grave disease. But here the history is chronic, telling us that it is a 12-year past history. So in the 12 year, usually I have seen that in the Hashimoto thyroiditis, the gland is decreased in size and it is smaller vascularity, then is also compromised. Here, still the gland is enlarged, bigger in size, both lobes, even the isthmus, and the vascularity is significantly increased, also showing the thyroid inferno type vascularity. So this was all about the thyroid gland. Now we talk about the nodules. Two type of nodules are present. Number one, cold nodule. Number two is the hot nodules. This is the radionuclide term in the scintigraphy. Usually, technetium or technon it is used. 99 is used for the radionuclide study, which we call it the thyroid scintigraphy, in which if the nodule is hot mean that this nodule is functioning. Functioning mean that this nodule is usually independent of the thyroid stimulating hormone, and it produces the hormones T3, T4 independently and in excess amount. This is called the functioning or hot nodule. And cold nodule or non-functioning, this is they don't produce the hormones, thyroid hormones. So this is the difference between the cold and hot nodules, the functioning or non-functioning nodule. Cold nodules are uh, more are also can be transformed into the malignant. It is although rare, but cold nodules are usually culprit to transform into the malignancy, while the hot nodules are usually benign. This is very, very rare that they can go into the malignant transformation. Very, very rare. While cold nodule is more prone to go into the malignant transformation. So when we see that now I am going to put the color to the nodules. We have seen the thyroid inferno in the gland. Now we see the color. This is the larger one, so I am going to take the benefit of this. Look at this. The vascularity is present within the nodules. Even the vascularity is present in the cold or non-functioning nodule and hot or functional nodule. So we cannot appreciate, we cannot diagnose we cannot differentiate the cold nodules versus the hot nodules. However, when the nodules are present and if it is diagnosed as a hot nodule in the thyroid scintigraphy, then along with the grave disease plus such type of hot nodule, this condition is called marine or marine Lenhart syndrome. Means toxic nodular goiter with coexist grave disease. So this is called marine Lenhart syndrome. So this scintigraphy will decide whether this syndrome is present or not. I will ask the referring physician to send the patient for thyroid scintigraphy to evaluate this syndrome. And so this was all about the. So in my opinion, the likely diagnosis is grave disease with coexisting thyroid nodules. Scintigraphy will confirm the Marine Lenhart syndrome. So bigger thyroid gland with chronic history, this deny the diagnosis of Hashimoto thyroiditis. So likely diagnosis is grave disease with coexisting benign sonographic feature nodules. When we will go for the scintigraphy, the whole gland is also hyperfunctioning, producing the thyroid hormone T3, T4. So these will be increased in the blood picture when we go for the hormonal assay, hormonal level. However, when we go for the scintigraphy, this whole gland will take the tracer uptake significantly, but this hot nodule, if it is hot, this will take more uptake, tracer uptake, and cold nodule, which will take mostly no uptake. The cold nodule, if it is present, it will take no uptake or very less uptake as compared to the grave disease thyroid gland. So this is also the differentiation when we go for the scintigraphy. If we differentiate the cold versus hot nodule will take significant or take the tracer uptake, while cold nodule will not take or very less. So this can differentiate. And if a grave disease is present with the hot nodule, whole gland is functioning, have an increased function, so it will also take the whole gland will take the tracer uptake, while focal further increase in uptake will be seen in the hot nodules. This was all about this disease process. So we will now see whether this is the grave disease with cold nodules or grave disease with hot nodules, that is called Marine Lenhart syndrome. Thank you very much.